had a number of those circumstances in which, you know, the child's perfectly okay, and the parent will come in and say, isn't there anything we can do about Johnny's condition? The teachers are raving, he's getting, you know, wonderful grades, but the parent just can't let go of the fact that the child's disorder is defining the purpose of the relationship. And we have, you know, if you're dealing with something like alcoholism, the statement I make to the alcoholics I treat, I can't cure you on a bar stool. I can't keep you sober on a bar stool.
If you're still going to go in the bar, you're...
And if they're going to hang around with environmental conditions that are associated with drinking, then our ability to change that is going to be, you know, limited. So there are a lot of things that can interfere with treatment. In terms of changing brain activity, that I can say without any reservation, we can modify brain activity and get it so it's
well, you can fix a brain.
range.
You can't necessarily cure teenagers.
That's right, my friend.
I noticed that even Terry's parenting class only goes up to age 12, he said.
We did that on purpose.
You did that on purpose. Can't cure teenagers. Okay. But let's talk about the other kind of closed head injury, the adults, because you, Dr. Swingle, absolutely cured a 50-year-old man that I am personally acquainted with who'd been mugged and left unconscious and spent 3 years, 1, 2, 3, in conventional therapy. And 14 weeks after he went in to see Paul, he was the same old guy again. I'm actually thinking of trying to get him to come down here and do an interview with you, and we should bring a couple of patients down that want to talk. We did that before on the old Rogers show, where we had one time patients from 6 different countries. Remember that one?
That's right, yeah.
That was a fun one. Bermuda, Walla Walla, Washington. They were from all over the place. That was fun.
Yes.
Because people do come to see you from all over the world, right?
That's correct, yes.
People send their kids. People take a vacation from Newark, New Jersey, come to Vancouver, and look after their child for the summer months, and they go home.
That's right.
With a fixed skid. How often does somebody need to see you? Now, I know that usually it's once a week, but is that because that's sort of a cost-effective chain, or is that because that's all the time, or is that the most effective?
Well, generally speaking, that's because it's most convenient. You know, once a week is not an excessive drain on the family, either in terms of scheduling or in terms of finances. And we can get it done at once a week frequency. We can do it up to 3 times a week. Now, if somebody's flying in from Greece, can't do it once a week, so we do 3 a day for, you know, maybe 3 weeks.
So you can really go at it if you want.
That's right. It's not as efficient when you're doing it that way, but we can get the job done.
So rather than tune up the Mercedes, the guy can tune up his skid.
That's right. Exactly.
And I hate to put it that way, but that's one of the problems that we've got here, is that because we have what I call a wonderful medical system, and I'm going to just use that on you, but the medical system, the provincial government Canada Health Act still doesn't recognize what you're doing and fund it.
That's right.
And why don't they? What do we have to do to make them do that?
Well, I really don't know. I've been in touch with you know, a number of politicians about it, and I think they feel that it's just too surmountable a problem. Insurmountable, I should say. But I've had the same problem in schools. You know, this should be in schools.
Well, you do, and I said Newark, New Jersey, and don't you have it in the schools in Newark?
Oh, there are a couple of schools in the United States, but there's a local school that I was negotiating with for over about 1.5 years. I actually brain mapped the principal, and at the end of 1.5 years, they said no.
Amazing.
And we were prepared to do it for virtually nothing, to train up a couple of people. And for simple ADD, you know, a teacher's aide under our supervision can make a huge difference in a child's life.
So if I came up with a school, 150 students, would that be enough?
Sure.
If I came up with a school, you'd do that again?
We would get set up. You betcha.
Have I got a deal for you, Paul?
Okay.
We're going to do it. Ladies and gentlemen, is there something else I missed that you want to talk to? We did closed head injuries, not that much. We've really covered fibromyalgia, and we've covered CFS.
We were going to do emotional trauma, but we can do that next time.
Well, let's take, I went and did that. We take 5 more minutes and, yeah, 5 minutes. That's emotional trauma. Let's try that one.
Okay. And
That's where you've helped me out after I got fired and my wife left me.
yeah, you had a trauma signature.
Yeah.
If I remember correctly. Yeah. When people are exposed to severe emotional stress and it's not processed, the brain shows that. So there's a marker for emotional trauma. The above and beyond the emotional side of that, there's also a cognitive side, and that's poor short-term memory. So we get some kids that are sent in with ADD diagnosis, and it turns out that they have a severe emotional history. That is exposure to severe emotional stress. Sometimes it's bullying, sometimes it's abuse at home. There are all kinds of possibilities. Of course they can't pay attention in school. They're terrified. Secondarily, purely cognitive level, the information is not being efficiently transferred to short-term memory because of the suppression of the waveform.
Okay.
So when we release that, there's an emotional reaction to it. So, we deal with the emotional side of it, but they improve cognitively markedly. Now, I also treat a lot of artists for artistic block. These are the guys that spend 2 years have I ever shown you the coin, the frame coin in my office?
I don't think so.
No.
I don't
I
reckon
have a
this is
25-cent piece that's in a fantastically ornate gold frame, and it's hanging on my wall in my office. And clients will often ask, what's with the quarter? Because it's a U.S. 25-cent piece, and it doesn't seem to be, valuable above and beyond 25 cents. So I tell this story. When I was at Harvard Medical School at McLean Hospital, there was a fellow who was hospitalized for autistic block. He was staring at a blank canvas for 2 years. Actually, this story is in my book, now that I think about it.
Mm-hmm.
So he walked into he was suicidal, that's why he was hospitalized. And so he walked into my office and said, I'll never paint again. And I said, I'll bet you a quarter you will. Okay? So the quarter is one that he framed.
Yes, and gave it to you.
The opening of his exhibit in Boston. So.
Good stuff. So you can, we all get that. I get writer's block.
Sure.
Sometimes I just can't figure out what to say. It's amazing.
Mm-hmm. There are all kinds of reasons for that. Trauma isn't the only reason, but trauma signature is exactly the opposite of the artist signature, and it suppresses the artistic waveform.
Mm-hmm.
Emotional trauma is almost always implicated in fibromyalgia. So,
I guess having your house robbed could be an emotional trauma, couldn't it?
Oh yeah,
very big.
Home invasion. We've had a number of clients who have been, subject to that trauma.
A rape, a mugging, any of that.
Absolutely. And, it doesn't have to be catastrophic. It can be cumulative.
Can it be a divorce?
A divorce.
Death of a child?
Absolutely.
Death of a spouse?
You got it.
So any of those things.
Or it can be just a, very negative childhood. There was no physical abuse, but it was just very negative. It's cumulative. So it doesn't have to be,
An uncaring father?
Could be, sure.
So all sorts of little pieces and things could affect you.
See, the interesting thing from my perspective, it doesn't matter what it's from.
It doesn't matter what it's from. You just want to fix it.
I don't have to be a nosy therapist. That's the nice thing about...
You can just see it there.
And we correct it neurologically. There's an emotional release.
You don't have to talk them through it.
So it's the most efficient psychotherapy on the planet.
But
because it engages the body's own psychotherapeutic
But that's what psychologists try and do. They're trying to talk you out of something or talk you through it.
Sure.
But it can take 10 years.
That's right. It takes a long time.
You take 8 weeks, 20 weeks?
And sometimes we, when the person's trauma releases, they need some help with it. So we might spend a couple of sessions with, traditional psychotherapy.
And you've actually taken people from almost vegetative status to a certain amount of cognizance.
Sure.
I met them.
Well, when you get to be my age, you know, you watch for that sort of stuff.
Well, I'm almost as old as Paul is, too. My guest has been Paul Swingle, and Dr. Paul Swingle, who is just a marvelous guy, and he fixes ADD, he fixes closed head injuries, he fixes fibromyalgia, he fixes chronic fatigue syndrome. And if you're in that position, my suggestion is you pick up your phone and you phone 604-608-0444, and you make an appointment to go and get your head examined. I did. Thanks, Paul.
Thank you.
There you go. Keep the change.
My gift. Don't need any.